The Venezuelan government has attributed recent spikes in COVID-19 cases in the country partially to a virus variant that scientists believe originated in neighboring Brazil. Inpatient care in private hospitals have become unaffordable for most in the economically battered nation, where workers earn an average. People who seek care at private hospitals face bills that can exceed $50,000 for 2 weeks of inpatient care. That is unaffordable for most in an economically battered nation where workers earn an average of $2 per month. Correspondent Maritrini Mena has the story.
Javier Garcia's wife and his mother-in-law both have COVID-19. When his mother-in-law's oxygen saturation levels started to drop, the family decided to treat her at home. She requires a constant supply of oxygen that Javier must pay for on a daily basis. Filling one large canister costs $30. That's 37 times the minimum wage. Several refills are needed per day.
No, the pockets of Venezuelans cannot pay for this. We pitch in among several family members using our savings. You have to find the money somehow.
After a recent spike in COVID-19 cases, sales of medical oxygen have increased across the capital as Venezuelans try to care for their loved ones at home.
Our working load has practically tripled. We used to sell 70 cylinders daily, and now we're selling 200 or 250 canisters per day.
Paying for oxygen is just part of the burden in severe cases. Private consultations, medications, and x-rays are all out of reach for the average Venezuelan. 97% of Venezuelans do not have an insurance policy to deal with COVID-19, according to estimates from the Venezuelan Chamber of Insurers.
Most Venezuelans seek care through the public healthcare system, whose quality has declined severely in the last several years. The scarcity of water, medicines, supplies, and personnel were common at Venezuelan hospitals even before the pandemic hit.
As Venezuelans look for alternatives, they have turned to social media and crowdfunding pages for help. Like Emiliana España, 6 of her family members got COVID-19 at the same time, and only one of them has insurance. The family started a campaign so relatives and friends from abroad could contribute.
Los venezolanos tuvimos que recurrir a esas páginas.
We Venezuelans were forced to resort to these pages asking for help because of our deteriorated healthcare system. Most Venezuelans don't have medical insurance. Here, the priority is to eat. It's not insurance.
Porque realmente aquí la prioridad de la gente es comer.
Today, Javier Garcia is living with the oxygen cylinders for his mother-in-law. Despite the financial burden it represents for the family, it is a price they are willing to pay.